Okay. My name is Regina Dogo, and I'm a public health professional. I'm so passionate about development and humanitarian work, like supporting people in the communities, especially those who don't have anybody to speak for them. I developed this passion right from 2011 when I had the opportunity of visiting some rural communities in Nigeria where people don't have access to basic health necessities like water, like health facilities, like electricity and all that. And this happened in northern Nigeria. So that's now motivated me to go further to study a course in public health. And thereafter, I also decided to work with non-governmental organizations to see how we can be able to address all these health issues, because in Nigeria, so many people are suffering, especially people in the rural communities, and they are being neglected, especially by the government. The only time they are being remembered is maybe during election when they want them to cast votes for them. That is when they recognize them. But so many people are living in areas that don't even have access to road, and that is what has developed my passion to like be a voice for these people. How can we advocate to the government to be able to help these people, to support these people, to be able to access these basic health services? Because these are Nigerians, these are citizens of Nigeria, and they have rights to health, they have rights to these basic infrastructures, but they are being neglected every now and then. And that is what drives me. When I see people smiling, people accessing water, health services, they have food and they are doing well, I feel so happy within me. So I'm not just limited to health or water services. I also do what we call empowerment, especially for the vulnerable population. And the definition of the vulnerable population, we are looking at women, we are looking at the girl child, we are looking at children, we are looking at the elderly. How can we help them, empower them so that they'll be able to fend for themselves and also take care of their families? Because when you empower a woman, you are empowering the family. So when I do all those things and I see women striving very well in the society, I feel so happy. So that's just my passion.
That's very interesting. Quite a lot, and also very interesting as it were, no? Because most of the things you touched are really very important. Whether you are looking at girls' education, looking at women rights, gender campaign against gender violence, and things like this, they are all very, very important, and they really need to be taken care of in our country. Now, I'm trying to understand why you were still growing up in Kaduna. You grew up in Zaria. You are actually from Kaduna, right?
Yes.
So tell me what you see around you. Give us a picture. You see, not everybody actually knows Nigeria. And in this podcast, we are actually connected globally. So to maybe people from whose ancestors are Nigerian, who maybe are living somewhere, they don't even know how that look like. Tell us, give us a feel of you growing up.
Well, while growing up, I grew up in the university quarters, and I'm this kind of person. I don't so much go out. I'm always like a bookworm kind of person. I know I go to school, and then when I'm coming back, you see cows, you see herders, you see farmers farming. And then when I get home, I just embrace my book and study. And then my secondary school, unfortunately, I was in a boarding house. So basically, I was always in a boarding house and all that. But growing up in Zaria, it was a lovely experience in the sense that we were neighbors and we were each other's keepers. Where when you have the Muslims celebrating their Salah, the Christians are also joining there. You eat the rice and all that. Same thing when the Christians are having their Christmas celebration, you'll be happy to like go and share rice because they will give you 5 naira or 10 naira. So excited. So sometimes you go with your friends to be visiting one house or the other, and when they give you rice, you like, we have eaten rice in our house already, so we need money. And when we come back, we are happy that at least we've been able to make something out of it. So it has really been an interesting stay, because you see people of different religion, people of different ethnicity, Igbo, Idoma, Igala, every tribe, you see people living peacefully there and communing with one another. Like anything that happens to this person, the other families will come and commiserate with you and all that. If there's any celebration, they come and celebrate with you. So it was more of like a communal living, you understand? Like we were in a community, we know each other, each other's keepers and all that. Although I
That's
did enjoy more of it because I was always in the boarding house, boarding house. After my secondary school, I still went to the university. I was still in the hostel. So it was more of boarding. And immediately I finished, I still went for service outside the state. So it was more of always out of the state, kind of.
That's lovely. That's really lovely. When you hear news like that, it make you want to love your country more, no? Because all this diversity that we have can actually be channeled to be something that we can celebrate, and we will never finish to celebrate it. They are just like the color of the rainbow. That is how I think it is. It really should be. Even though sometimes some people do use it against us, it's just like the cricket, though. You take the cricket, you fry it with its own oil. That is what they do to us sometimes. But that oil is actually something that is beautiful about us. Why can't we use it to celebrate the beauty of Nigeria? So thank you for sharing those moments. All right. Now, is there anything that actually lead you to have interest in public health? Say, as you were still growing up, is it maybe from your family or from your friends, or is it because of the environment you were living in that make you develop interest in wanting to know more about a health issue? And of course, I know that later you will go to different program, but I'm still understanding now while you were still younger, if there is anything particular within your family or within the neighborhood that make you have curiosity about health.
Well, basically, while growing up, you hear people saying when I grow up, I want to be a medical doctor. When I grow up, I want to be an engineer and all that. But for me, I never had such thoughts. I was like, well, let me just do and finish school. Even though, yeah, I wanted to study medicine, but that opportunity never came up. But that notwithstanding, I just wanted to do something that will help the community, like put a smile on people's face. Even though then I was young, I never knew the approach I was going to use, but I knew that I had that passion right from when I was not like give a helping hand to somebody, though it was not properly defined as at then until I had this exposure after my university days and I really understood, okay, yes, there's this particular way that you can go about doing it. But right from childhood, I just had that passion to just give a helping hand, to support people, to see how people can grow up.
Mhm. All right, great. Now, looking at northern Nigeria, where you grew up, of course, where you are, where you have more knowledge of the Nigerian world, as it were, how would you describe the health situation in the north of Nigeria? How is it like? Give us some information you feel is necessary for us to know.
In northern Nigeria, I believe that the government on its part has made its efforts to provide to an extent health care facilities. But you see, northern Nigeria is made up of a large land mass. You understand? Like if you want to move from one community to the other, you have to travel a long distance. So you see that most people are living in the rural communities in depth before they can even come out to access healthcare facilities is even difficult for them. And the perception that people in the northern Nigeria have about seeking, that's their health seeking behavior, is that people have so much embraced religion that anything that happens, we just say, okay, God permits it, or God is going to heal me, or God is going to do this, God is going to do that. When you have the health facilities there to help you out. So many people are so attached to the religion that everything, in fact, there were times that when you see a woman in labor, instead of you taking her to the hospital, she's bleeding, you say, okay, let's perform some religious rites. Sorry, I will not be able to mention it here. so that it doesn't instigate something, you understand? So there are something that you say, okay, when you do it based on the religion, she'll be okay. And they did it, and the woman just died. This is something that can be prevented, but because of our religious perspective. And one thing is that, yes, when I grew up in the North, some of our mothers, they give birth at home and they give birth successfully. We can't dispute that fact. But when there are complications and the health facilities are there, we need to assess it. But one of the challenges we are having in the North aside religion is the issue of poverty. Some of us cannot even pay for our medical bills. So we prefer to stay at home to give birth. While some will tell you there are no female healthcare providers in the health facilities, I cannot allow my wife to go and be attended to by a male health personnel.